Hello, everyone, and welcome to the Sweet Institute. This is going to be a mock role play of a sample mock role play of a first clinical supervision session where Marta Shea is going to play the clinical supervisor and I'm going to play the clinician. This is the setting for this is an outpatient community-based center.
Hello, everyone. Thank you. Hi, Karen. Good morning.
Good morning, Marta Shea.
Thank you very much for being here. How have you been?
I'm okay. Thanks.
Really great. So tell me how you've been settling down so far at the clinic.
It's been, it ebbs and flows between slow and busy because it's still like a new setting. And I'm still adjusting to being here. But it's been good. I love the clients.
Great. Wonderful. Wonderful. And so far you have everything you need.
I'm still having some difficulty getting into the database, but I'm working with the IT people on that.
Perfect. Okay. Thank you for letting me know. We'll definitely make sure this is done. We'll follow up on that together. Okay. Right. Now, Karen, this is the first time we're meeting, and for sure, I wondering what it's like for you overall to be having your first clinical supervision meeting with me right now.
It's been a long time since I've had clinical supervision, so I don't really know what to expect, and I'm a little reluctant to have my expectations that this is going to continue, but
Yes, really thank you for saying that. And perhaps I'm definitely going to tell you what we can expect together from that first session. And before that, I wonder whether you could briefly tell me just a little bit about yourself, Karen.
Sure. I've been a social worker for 10 years. I've been an LCSW for 5. And I've worked in an ACT team before, and I worked in a PROS program, and now I'm here.
Beautiful, beautiful. That's really great. And now, being here, how long you studied again to make sure? How long you've been studying here? You studied?
I've been here about 2 weeks.
2 weeks now. Wow, it's really, and you really adjusting pretty fast. So more later about that. I'm just going to tell you just a little bit about myself very quickly. And so I'm as you know, I am the clinical supervisor here for all the social workers, and it's a work I've been doing for some time. I really enjoy. That's the very best part of my of my day when I'm here, and we'll talk more later about that. But to shift, and then at the end you will be able to have some questions. But to shift gears, I'm going to tell you what we can expect for today. Today, I am going to have a sense of what of number one, as you said, actually, if I heard correctly, that you never had supervision before.
Well, I mean, I needed it to get my C, but it was really, it was more of, I went to my supervisor when something came up and I didn't know what to do.
Okay.
And it was just something that there was a formality about just signing the form so that I can get my C, but it wasn't consistent, and it wasn't, sometimes I met with peers instead, and so it wasn't something that I had a regular experience of.
Okay. Thank you for saying that, because this is one of the main things we'll be talking about today in terms of your past experiences with supervision. And then we'll move on to hear a little bit more about yourself, but in a focused way. What will be in terms of as it relates to clinical care? I'll be asking about strength and then passion and all that interest. And then I will then we'll talk a little bit about supervision, what you can expect from me as well. And then after that, we will move on to hear any questions you may have. How does that sound?
Okay.
Okay, great. Now, you did start telling me about your past experience with supervision. Let me go ahead and ask you anything that worked at all, and then what worked best, if anything worked in your past supervision experience.
What worked and then what worked best?
Mhm.
So, I mean, it's hard to say. I mean, I think my supervisors were really smart people and were really good clinicians. And I think they had good values in terms of, in terms of like how they viewed the clients, and that they really liked them. And there wasn't a whole lot of pathologizing. There wasn't, like acting that's not really medical model-ish. So I think the staff have to kind of follow that framework. And PROS also is very kind of anti pathologizing as well. So I think that was, I think our values aligned in a lot of ways, but my supervisors were always busy. So it's really hard to, I mean, when I needed something, I got it, but, and like I said, they were really smart, but it just wasn't, it was mostly like paperwork and how to complete things so that billing could get done. And, and some crises, like they were really good around crises. Not so much at the PROS program, because there wasn't a whole lot of crisis, but in the ACT team, there was quite a bit. And so they were really good at helping me as a new social worker in particular, in navigating different crises that came up. But that was mostly the kind of supervision I got.
Okay. Thank you, Karen. That's very helpful. Now, tell me what in general, what would you say then you wish could have been differently? I heard a little bit of this, but more
I mean, I think the obvious thing is consistency,
okay.
right? I think now I am hesitant about investing in like getting supervision because, to be honest, because I just haven't in the last 10 years. Lots of promises that it's going to look a certain way and then just doesn't happen. So just so you know where I'm coming from. So consistency, I think, would be really helpful. And as a new social worker, if I were to go back and look back at those experiences, I think it was really helpful to learn about crisis, but there wasn't, a lot of it was kind of going off my gut. And where I think I have good gut instincts, and I think school helped with, an internship helped with some of it because there was a requirement for supervision. And it was more, I mean, I had more supervision as an intern than I did as an employee. But I think it was I think a lot of what I ended up doing, like I said, was gut and superficial. So I don't think that, I just think there's a better way to make an impact in people's lives. And I don't think that I've been able to fully find out what that is, I don't think also the work that I did and the supervision that I was getting allowed for a lot of reflection. Because there was just this, the pros program, I actually was there for a short time because, because it was very slow. There wasn't a whole lot of, it's a lot of groups and things like that, which was a good experience to learn how to do a group. But, I didn't feel stimulated by the work. So I was there for like a year and a half versus the ACT team. I was there for quite some time. So anyway, so I think I just didn't have an opportunity to go deeper with any of the work. And it felt like a lot of crisis management rather than being able to figure out how to work with people so they're not in crisis.
Mm-hmm.
Or when they're not in crisis, it's sort of like waiting for the crisis to happen so you know what to do, but not knowing what to do when there's no crisis.
Yeah. Thank you for that. Yes, I'm hearing that consistency and that proactivity and that foundation, and very good, Thank you.
And going deeper, not staying superficial.
Yeah, absolutely. That's very helpful. And the next thing for us to look at right now together, Karen, is to you, what tell me what supervision, clinical supervision means to you. And I think again, you actually touched upon some of that already in your wonderful answers.
What does it mean to me? I think clinical supervision, in my ideal world, I think clinical supervision is a place where I can take risks, and explore things that may be coming up that make me uncomfortable, or that, just to be a place of reflection and be comfortable enough to do that. And to be like, to have it modeled to me, like I don't want to be in a process where I have to guess a whole lot of stuff or make it up as I go along, like, oh, excuse me. I think I learn well through modeling, through watching somebody else do it, and listening to like you talk about your cases and stuff, and being able to pull from those kinds of experiences. And then being able to come back later and say, I tried it and this is what worked and this is what didn't work. And what did I do that was wrong? Because the outcome wasn't what I was expecting, or I got really scared, or I stopped doing it, or I cut myself short, or whatever it was, like being able to come back later and find out what I did wrong, so that I could try it again or get it fine-tuned.
Mm-hmm. Okay, very good. Thank you, Karen. And as we proceed with that first meeting, it's been a little bit while that we started talking. Let me ask you, is there anything we can do right now to make you feel more comfortable? Just checking in with you in the room right now.
I don't know you, and I'm excited about, like I said, I mean, I've seen you around, but really this is the first time we're meeting. And so I'm a little nervous.
Mm-hmm.
And I don't know that that's just going to be where I am right now, and, muddle through that.
And thank you for saying that. I really appreciate that. And tell me if there's anything we can do right now and to either make you feel less nervous and feel more comfortable.
No, I think it's going to come with time. Thank you, though.
Oh, great. You're welcome. Okay. And as we continue to talk about supervision, you just told me what supervision means to you. And again, from that answer and from many other answers from prior um, inquiries, I definitely may have heard some expectations you have that include, though they do not limit to being able to have a place to reflect on the work, to have some modeling, to go deeper, to be able to be a bit more proactive and less crisis driven, to have some consistency and all that. And so in addition to those that been mentioned, what would you say you would expect from me? What else, if anything, you would expect from me as a clinical supervisor?
I think right now it would be more finding out how you do supervision. Because I don't know I've never really had supervision before, so I don't even know how to answer your question.
Yeah, very good. And this is a really great segue, Karen, because as I asked you what supervision means to me, I'm going to also tell you what supervision means to me. I asked you what supervision means to you. I'm also going to tell you what supervision means to me. And it's actually not really like anything written in stone. It's just really obviously there is the foundation for in terms of clinical supervision, which you have touched upon many of them actually. And so in addition to many of those things you said, to me, clinical supervision means you as a clinician, you have a space where you can feel and be free to be that individual, regardless of what your experience is, to just really be there authentically, genuinely, and be vulnerable around your work with your clients. And that really is the foundation that means everything goes in terms of what works best for you. Of course, there's going to be a framework that we're going to be talking about, but that is actually what going to be guiding that. So what that means is we will take a look at how everything really that has to do with you does have an impact on the actual the work you do with your clients, which means you need to feel free to actually be able to discuss them. And we'll be talking about parallel process that I'm sure you may be definitely very much familiar with, and how that is going to be guiding our work together. So that's the first thing I wanted to say. The second thing is that we will be talking about framework, and part of the framework will include 360 evaluation. Now, we're not talking about that yet, but I'm saying that right now to say that how I work with you has to will be what works best for you. In other words, whatever we're doing together, the moment you find that, okay, you would like to get more of this, or I don't think this part is working that much for you, we're really going to continually checking in to make sure that you feel that you have the opportunity to really discuss that. Because if it's not working for you, it's not working, because it's really what works best for you. And let me know what your thoughts are on that, and then we can shift back to really get into to really continue with the setup.
Well, just to I wrote 360 down, but I think you said you were going to go to that later.
Mm-hmm.
So that was it really.
Yeah, okay, perfect. We'll talk about that. Okay, great. Now I would now for as I said, I really explain a little bit what supervision means to me, and then what actually you may expect from me. You already told me what you expect from me. Now for this to work best, as you can see, we're talking about tailoring this to you. I would like to hear a little bit more about what you feel your strengths are. So that's where I would like to shift right now. What would you say your strengths are as a clinician?
I'm good with crisis. Um, I think my strength, I believe in people's abilities to heal and to grow. I think people should do the things in their life that make them happy. And that they need to know what that means for them, like what happy is for them. And I don't think there's limitations on what our clients can do, no matter what their diagnosis is. And I've been able to see like people do some pretty amazing things. I like being in the field. This is going to be a change for me because this is more, clinic-based work or community center work based. But I like being in the field. I think that's a strength because I don't think everybody does. And seeing people really where they are versus just saying it. I think I'm really good at listening to what's not being said. Maybe not as good as helping people bring that forward, but I usually can hear that there's something else going on. I think I'm a pretty good problem solver, although I've also been learning that it's not my problem to fix. Yeah, I think those are some of my strengths.
Thank you, Karen. A really beautiful crisis intervention. If I'm hearing correctly, I'm hearing that there is that client-centered. Really, I'm also hearing that a lot of strength-based, really, and so I'm hearing that you do have your bedside manners are really great around. Also, your soft skills, which are huge, being able to establish rapport and engage and listening to your clients, in addition to helping them solve the problems, and which will, as you said, we'll be talking more about this as we move forward. But this is really great. This is really great. And as I'm hearing those trends, and the next natural inquiry question for me to ask would be, you did mention already again what supervision means to you, and then what you did not have, what you wish you had, and all that. And as you know, the way our brain works is the more the simpler, the more concrete and direct it is, the better. And therefore, I would like to ask, having said everything you've said so far, and including having articulated your thought, what your strengths are, I would like to ask you, tell me why you think you need clinical supervision.
Because I don't know sometimes what I'm doing. And I don't want to just rely on my gut to help me figure it out. I want there to be like, my gut can't be the default because there's a limit to what my gut knows. And I want to be able to rely on, I'm good with the soft skills, but that they only get you so far. And there's only a certain kind of soft skills that I've developed just based on my experiences. And that's just not enough. I'm not, it's not going to sustain my clients. It's not going to sustain me. If I'm just going by gut and I don't have something, more substantial to hang my hat on.
Beautiful, beautiful. Thank you, Karen. And we something we will definitely talk a lot about, as you've mentioned on several occasions, right? Relying on your gut. You really want to have some more frameworks to do the work. Okay, very good. And we'll talk a lot about that. Thank you for that. Now, the next thing, as you talked about your strengths, I would like to hear more. I can hear that in your voice as you talk about a few, and in some of the words you've chosen. And I would like to now be most explicitly asking, what would you say you're most passionate about when it comes to this work?
I don't know. I mean, I like what I'm most passionate about is, I guess, seeing people. I don't know. There's being able to see people like have the things that they need. I think the systems that our clients engage them are very limiting. And so like the more you can move somebody further out of the system, even if they're a little bit in it, but have more independence from having to rely on systems. I think there's just something really powerful about people being able to stand on their own 2 feet and have the things that they need without having to rely a lot on because like being able to get a job and being able to like have your family, reconnect with people, get free of drugs, or like don't get free of drugs, but it doesn't interfere with how you function in your life, like whatever it is, but seeing people live, like really live, not be confined to how the systems choose to treat them.
And I'm hearing, thank you, Karen, I'm hearing recovery, really based care, which is seeing how individuals are living despite their diagnosis, and really that's really
And
useful.
their circumstances.
Yeah, very good. Now and in this vein, you mentioned earlier, as you said, a lot of time you would like to not have to just be relying on your gut feeling and all that. And then you really talk about those strengths, and then your what you're really most passionate about. And the question is, what are some areas you see for you as some areas of improvement?
Well, paperwork, but I don't think that would be here because I think that would be my task supervisor. But yeah, getting organized around paperwork, but that's for them. I think there's, I think one of the things that makes me nervous or I guess nervous or anxious about this new role is how different it is from some of the previous roles I've had. Even in the pros program, there was a lot of flexibility. There was a lot of like, it was a lot of fun, right? Like, it was because it didn't have like a whole lot of, it was sort of loose structure, like flexibility and looseness within structure. And this is a very different setting. And the work that you do with your clients is much more intentional, and much less seat of your pants. So I don't know. So this is all very new for me, like sitting down with a client and not doing case management, or like not saying, oh, like, let's just go together, and doing whatever clinical work we're doing while we're on the way to the HRA office, or a housing interview or something like that. And it being more structured. And I mean, I did, like, when clients came into the office, or like I met with them at shelters or whatever it was, like there was clinical work being done, and psychosocial evaluations and things like that had to be done. But there's like a process here that is just not one that I've been trained in before. And so, like, I think that makes me anxious because I don't know. And that's why I actually accepted the job and applied, because I don't know how to do this quite so. And I imagine it's different.
Very great. Very great. Nice. Thank you for the insight here, for articulating that. And tell me if you've already, I know you've started only 2 weeks ago, so that, but tell me if you've already been thinking about, I don't know, a plan to, as part of working on those areas.
Well, I did ask, nobody's given me a response yet, but I did ask, like, what the training protocol is, or onboarding training process. Because I think for me, it'd be helpful to like sit in on somebody else's sessions. But these first 2 weeks have been mostly training about like different clinical interventions, how to use the database, policies and procedures. Like there's been a lot of like in-house training. I haven't been, really assigned my caseload yet, as I've gone through this process. And I don't know what my first step, like, I'd really like to, I mean, I get, I've kind of been told a couple of times, so we'll let you know. And I think there's, like, I've been a social worker for 10 years, like I should know. And I don't. And so I think though, for me, sitting in on sessions, somebody else's sessions, to just kind of like get my feet wet, or see, how to navigate it. I mean, I feel like these are really basic things that I remember from being an intern, but my first internship was in a partial hospital. And my second internship was in a school-based program. So I think I can pull from those experiences is like what you do, and it's certainly how I would want to be treated. But, I don't know what that looks like here.
Okay. Thank you. It's very exciting. You actually have a plan, and now this is the next step is for us to work on implementing that. So we'll definitely circle back to make sure that you really have what it takes to implement that plan.
Okay.
Really great job. Congratulations on that. This is great. And as we are looking at all this, Karen, the question for you is, so you do have a sense, a really good sense of your work and what you need. What would you say makes you unique as a clinician?
I think that I'm really funny. But I think where that helps as a clinician is engaging with clients, and being able to use humor in the work, and also being able to hear other people's humor, and I don't take myself all that seriously. I mean, I do when it's appropriate, or do it when I feel like my feelings are hurt, but most of the time, I'm pretty, comfortable with kind of my wacky. And I think that's what also helps me get along with the client population that I've worked mostly with, is like, I get it. So I think that's, I think that's one of the things, I guess, that makes me unique. And I don't know if it makes me unique, but I really do, and again, this is like the, expanding myself and moving into a different kind of role. I like the dirty work of being a social worker.
Mhm.
This is a little bit cleaner than I'm used to. But I like the grit, and I like the being really where clients are. And I think for me, this is just learning how to do it in a different way.
Beautiful, Karen. Very beautiful. Thank you. And in this vein, Karen, as we've been talking about strengths and then what you're passionate about, areas of improvement, the differences between here and a different work you've done before. And then, as I said, also, this is going to be tailored to you. This is exactly what really will work best for you based on where you are at any moment during our work together. And for that, one thing that will be helpful is for me to learn what you think is your best learning style.
Um, I think by seeing somebody do it and then seeing how I can apply it. Like, all of these trainings that I've been going to have been really great. And there's skills that I see in it, like the miracle question, motivational interviewing, things like that I know I do, but I just didn't know what they were called. And so now, like some pieces have come together. And they have, in some of the trainings, they've had some role playing, which I thought was really helpful, because I get to see how it's done. Because theoretical is great, but being able to translate theory into practice is, I think, really important. And I can learn that better by seeing it and then trying it. And seeing how it fits on me and in the work, because there may be things that work better in my style or work better for a client, and having like a tool bag of things I can pull out. But I think seeing how something is done really works, like language that people use when they work with clients. Because, like, again, there's the theoretical, and then there's like, this is what you say, but then like being able to watch somebody do it as a dialogue is different than reading on the words, reading on the page. If you woke up in the morning and everything was different, what would it look like? It's like, great, what do I do from there? What do I do if my client doesn't know how to answer the question? What, like all of those things. So being able to watch somebody move through the process, I think, is really helpful.
Beautiful. Thank you, Karen. And I said we would touch upon the framework we're going to be using together. And part of the framework obviously will include both process and content. And for example, Karen, one thing, and as we talk about the framework, you'll also get to learn more about me, as you said. You'd like to know more about me because the framework does reflect a little bit more about me, how I work as a clinical supervisor, and how I think that really would really help us make sure you get the best out of this work together. And number one is truly looking at supervision, clinical supervision, as a sacred moment. And that's very important, Karen, because you see, many times, unfortunately, things come up, as you said, crisis. But then I would like us to start looking at how supervision, clinical supervision, is as important as an appointment with one of your clients, because that's your leverage. That's, as you said, that's your place in the room to get what you need, right? So then where you get replenished, and then so that you can continue to really provide for your patients and clients. Now, having said that, it doesn't mean emergencies don't happen, urgencies don't happen, but we will really talk about with time how we really to make sure that we work on that, and therefore scheduling is important. We'll work on having a specific day and time where, so that there is, as you say, that consistency, that regularity, where you can then work, schedule your clients accordingly, but making sure that you pay attention to before and after, and after, and before supervision, whatever is happening, to make sure you have that space. Whether you're gonna schedule something that may decrease the likelihood that there is an emergency. So we can talk about that, but that's something also you will be empowered to really make that happen. Another thing around that we need to talk about is what takes place in the supervision is going to be around two things. There's going to be a framework, but there's also going to be a process. And for that, I would like you, if you don't mind, to actually establish the agenda for each time we're going to be meeting.
Okay.
And then, which means you can just send me the agenda now. Of course, you send it to me, and then when by the time we meet, if there's anything that you need to change, that's totally fine. But at least that will help create some intention, make it more secret, make it more consistent, more predictable, as you said, and that really will be helpful. Okay, and now another thing.
I'm sorry, is there like a specific way you want the agenda to be? Like, is there things that you want me to make sure that I include in it?
Yeah, so that we will definitely talk about that, but for now, yes. So I would like you to, going forward, start thinking about clients that you definitely would like us to start talking about, having your brief, concise, really clear description of the client, so that then, like that, the time will not have to be spent in just trying to figure out about the client. So you have something clear, concise. And then number three, really what you think really is going on with the client, and then what that's been done so far, how it's worked, what seems doesn't seem to be working, and therefore what the question is, what the actual question is, what's the actual challenge is right now, what the question is. This framework, this template, these components, we definitely can use them for any type of client you want to discuss. Do you want me to repeat?
No, I have the client to talk about, a brief description, a brief and concise description about the client, what I think is going on, what has been done, what's working, what's not working, what's my question or challenge.
Exactly. Very good. And then you can just plot, so you can have the same template, and all you changing is just the actual client, the actual description, right?
Okay.
You bring that, and then, so that will give us a nice framework for us to work together. Yeah. Any other questions around that?
Mm-mm.
Okay. And how does that sound, this framework? How does that sound to you?
Yeah, I mean, I don't really have, I mean, it sounds it sounds good. I don't really, I mean, it sounds good. We'll see what, I mean, I don't know what it's gonna look like, but it sounds good.
Yeah, definitely. Now, another thing, Karen, as I talked about as part of our work together is the 360 evaluation. Now, 360 evaluation, if you look at it, it starts here and then it will continue on and then all the way to where it started, which means I am going to be evaluating you. And now very briefly, I would like to ask you, do you have a sense of why I would be evaluating you?
Well, you're a supervisor.
Yeah. When and why, but then why evaluating you just because I'm a supervisor?
I mean, I'm sure it's part of my job performance.
Okay. Yeah, partly. And then do you have a sense of what I would be evaluating you on?
Maybe progress with my clients
Mhm,
or maybe my growth as a
mhm,
clinician.
mhm. Very good. Very good. So there's few categories of things I will be evaluating you on. The first one is yes, you'll definitely work with your clients, and those will have subcategories, right? So for example, you already have all those soft skills, but then looking at, for example, what we call your diagnostic skills. So those are a little bit more some hard skills, your diagnostic skills, number one. Number two, your treatment strategies, your treatment planning strategies. And number three, your decision tree, right? So for example, by decision tree, we'll talk about that. So okay, we did this did not work. What did I do next? And then right. So having like not just this is what we're gonna do, but then what happened when I'm stuck, your decision tree. And obviously that's something we will be working together on. And then number three, your ability to discover
Or
when you actually need help.
so what I have so far is I will be evaluated on my work with my clients, diagnostic skills, number one. Number two, treatment strategy and plan. Number three, my decision tree. And then my number four, my ability to discover when I need help. Okay. And you said that there were going to be other things that I'm going to be evaluated on as well. Do you think we can take a break?
Very good, Karen.
Oh,
And,
okay.
and wonderful. Now, so that those were good. Yeah, so those were really great. And then other things you'll be evaluating on is your own development. You talked about your strengths, that you come here and we would like, I'm sure we're gonna be talking about your goals, which is the next question I'll be asking you after we talk about 360 evaluation. And then those goals we'll talk about your developing a plan around that. We'll do, and then we can really track that progress. So what does that mean is that as you are growing, then the care for your clients also is really getting more effective. And then so this is about the best care for the clients through your development. Any question on that before we move on?
Not so far, no.
Okay, now I'm gonna to finish with the 360 evaluation is that you get to evaluate me. And you're gonna get to evaluate me on not first of all your own expectation that you have already articulated to me, and then I said, okay, this is what we're going to do. You get to evaluate me on my level of consistency, where how my flexibility, how present I am when how responsive I am, and then you also get to evaluate me on really how well I really get to help you whenever you have a challenging client, or you have those challenging questions, or you feel quote stuck unquote with your clients. And you also get to evaluate me around my level of professionalism as well. You get and really and in around really the effectiveness of the work we're doing together. Okay, so that also will have templates for that. All those are for you to just think about, but you have template around that. Any questions on that? Okay, so we're almost done. So so for before we're done, the next question is to really quickly think really ask you about some of your goals as you start working here with your around clinical care and also around your clinical career.
Um, oh gosh. I don't know, because they just seem very general, in terms of like, um, I guess in terms of my clinical career, I guess there's something about like, I wanna grow in the field. Like as much as I like working with individual clients, and I think I'd likely do that forever. I also want to be able to expand and move into more leadership roles. I don't know if that's relevant here. But but perhaps it would be. And I think I think it's just more about having like really tangible skills, like knowing what I'm doing.
Mm-hmm.
I don't know if I'm explaining that all that well, but really kind of knowing, like really knowing what it is that I'm doing. So it's not there, that there's more strategy related to it rather than like, but also flexibility within that. I don't want it to be like I only know one thing, so I only use one thing.
Mm-hmm.
So like I don't, I want to know about how to use CBT, but I don't want that to be the only thing that I use, because not everybody may find CBT helpful for them. But I want to be able to like, but how do I do it? And like, how do I do it in each session? How do I recognize what somebody's, how to use the skill and how to like bring people back to it? I don't know that I'm necessarily looking for things on particular diagnoses, because like you could look that up. And I have a DSM, and like, and I'd really be more interested in what my client says about what's going on for them. And it's going to be written in whatever their medical records are. I want to know how to do the work with the clinical skills. And if I get stuck around like a diagnosis that I don't understand, or like what's the client's presenting with that just doesn't seem to match for me, like then I can bring that stuff up, but I just want to know how to do stuff, if that makes sense.
Thank you, Karen. Yeah, we'll continue to thank you. That's very helpful. So I heard you talk about perhaps some form of advancement in your career. I heard about, we'll talk about diagnostic skills because you may also suspect that diagnostic skills not just reading the DSM and
Okay.
plot the actual criteria. It's really more than that. And number three, in terms of doing, we'll talk. You said that from the very beginning, what doing mean, what doing looks like. And I love the idea, as you said, you may know CBT, but not just CBT, because yes, many clients may not find it helpful. So we'll be looking at treatment modalities, which means when we meet, as you have your agenda, and as we discuss our patients and clients, we'll move your clients, will build on that to actually also look at skills. We'll also have some skill-based session where we'll look at some really some modality and narrative therapy. We'll look at that, the emotion focused therapy. We'll look at that, DBT. We'll look at some of those components, and then now to also use some parts of them to really do the work, motivational interviewing, as you mentioned. Also, some patient may require some solution focused, and then some IPT. We'll definitely look at really that we'll look at a number of modalities. So we'll look at both process and then content and soft skills and hard skills. And then again, as we move forward, you continue to identify things you need. Whatever you need, you let me know. And if there's anything I don't know, we'll really learn that together. That's really so that we can make sure that we make that happen. Very good. Now tell me what questions do you have for me, or any other questions you have for me?
I guess the only other question that I have is, the is about confidentiality in here. And, I have 3 supervisors right now. And so like I have my task supervisor, I have my clinical supervisor, and then there's the director of the program. And so I don't, like, I get what everybody's roles are, but I don't know like how to navigate like the different relationships in terms of what's, you had talked in the beginning about this being safe and me being able to be vulnerable here. And, I just, with 3 different supervisors, I just like, I don't know what, I just don't know how to navigate that.
Powerful. Thank you for asking that question. Yes. Now, what we discuss here in this room is really confidential. What won't be confidential is my evaluation of you.
The 360?
That's correct. And by the way, you and I will discuss the evaluation before it's final, where you will sign on it and I will sign on it. And so you will know what will be shared with your task supervisor and with Dr. With the director of the program. So that really is something that you will be aware of. But everything else, there is it's really confidential. Now, why that is because, as we said, this is a place where we want to to keep sacred and safe, so that you really, this is the place for you. You really feel you can be who you truly are. Your mess up, or your this, or your best day, your really not great test day, and then this is really the way we actually make sure that happens. Otherwise, then there's gonna be something missing if you know that, wondering who else gonna know about this. Yeah, so about your evaluation, which will be discussed with you, that will go to HR, that will be part of your portfolio.
And how often is the 360 done?
Yeah. So thank you for asking that. Actually, I failed to say that. We're going to have your first evaluation 3 months after our work together. Okay, and then after that, we'll have an evaluation in 6 months later, and then after
Or
that, it's
9 months from now?
9 months from now. That'll be your second evaluation. Okay, and then after that, we will continue to have it every 6 months that's we would like to keep you here forever. So for the first 2 to 3 years is every 6 months, but after 3 years, having shown really having have an evaluation where we will discuss what that means. When I say an evaluation, that's wow, like really this is the clinician. This then we move to yearly after 3 years. How does that sound?
Mhm. So it's 3 months, 9 months, then every 6 months after that for 2 years, and then after 3 years, it's annual.
Correct.
Okay.
Okay. What other questions do you have for me?
Is my part where I'm evaluating you, is that included in the 360 that gets submitted?
Yes. So whatever you have for my evaluation, that also is part of your 360 evaluation. That belongs to your file, and also I have my file as a clinical supervisor. We've been, it's, I have to tell you that something you will learn about this center. We've been working very hard to make sure that we keep as much transparency and as possible, and we've been able to establish a 360 evaluation where everybody gets evaluated by everybody, and we really and we discuss, and you will see that we do a lot of work together around team base, because this is what it takes. We take parallel process very seriously here. So that's we're lucky we have that.
Okay, thank you.
You're welcome. Tell me what other questions you have for me.
Do you know when I'm gonna start getting clients?
So now that we have our first session, and I know so I think we are going to work on number one. So here's what I'm going to do, by the way, is sending you some days and times.
Mm.
And then you will choose what work best for you. And then number two, we're going to really discuss ways of communication. So obviously email is a formal way. I also really will give you my work phone numbers. If there's any, let's say I'm out, I can be out in a meeting and all. So you can actually text me or call me if you have or something to discuss in an urgent way. Okay. And then the third way we'll communicate is when we meet weekly in person. Okay. And
Oh,
then
I didn't, yeah, I don't think we had established this was weekly, so I'm glad you said that.
Okay. So we have your supervision weekly, for your first, especially for in the beginning. With
Okay.
with time and evaluation, we will, after each time we evaluate, we'll discuss next the same framework, but next focus.
Mhm.
And probably the focus may be whether we focus more on diagnostic skills, we mean real diagnostic skill, not checklist, or whether we focus more on treatment modalities, whether we focus more on you looking at your own counter transference, or whether we focus more on you, we thinking what it means to really help your clients, what it means to do with your or for your clients or your clients. So things like that. Those are examples, obviously. And then we also discuss, okay, frequency. Whether now it means every 2 weeks, whether or not it means, yeah. But right now, until we get there, we're meeting weekly. That's part of what we're gonna do. We're meeting weekly for about 45 minutes.
Okay.
Okay.
Now you said you're gonna send me days and times. Can I request, is there a preference that I know you said I can choose. But I'm wondering whether or not there's an opportunity to do it first thing in the morning. Before like things get really started. So I can start my day with supervision, is whether or not that's an option.
Yeah, that's actually one of the options.
Okay,
And then that also is often a preference. We will make sure that this is a time also you can make it here on time.
yeah,
Um,
I'm early, like for me, on time is late. So like and I'd be willing to even come in earlier. If that's an option too. So I'm a morning person, so I like to come in earlier because things are quiet and you don't get disrupted as much.
right.
So, if those are options, I mean, I don't want you to come in early just for me, but if that's an option, and something that you could do, that would be great.
Yeah, thank you for letting me know about early morning for you. Yes, so this is one of the options I will be sending to you. From experience, Karen, I find that when supervisors meet first thing in the morning, they have their days plan, and then they feel more comfortable to be meeting with their patients and the clients. I will find that.
Yeah,
Okay.
that's,
Um,
yeah, that's what I mean, you know, not that I've had supervision before, but when I get to go into work early and I kind of set up my day,
yeah,
there's just a nicer flow through the day. So
yeah, yeah.
I prefer mornings.
Okay, perfect. Perfect. And then so so when we meet, so the moment we're done here, I will send you something I would like us to start next week. And then
Okay.
I would like us to talk next time about your first encounter, your first client encounter. We'd
Oh,
like us
yeah,
to work
that's,
about that.
yeah,
Okay.
that's what I had asked you before, if you knew when I was gonna start
Yeah.
getting clients.
And then the moment we're done with that supervision, that's when you start seeing.
Oh, okay. So I'll start getting clients next week then.
Yes,
Okay.
after that supervision, because we want to make sure that you're all set with your
Okay.
because all we
Hopefully my
establishing
login to the system will start working before then.
correct. Yeah, so we're establishing a culture here where around how we make sure we remain client-centered, and as you already talked about, strength-centered, trauma trauma informed, and then really with cultural. So that means we want to make sure that every new clinicians um truly so we talk about that, and then you start seeing your client, and then the next time, third time, that will be the third time we meet. That will be your agenda. You'll be sending me
Okay.
that. Okay.
Okay, great. So I don't need to have an agenda for next time?
It's not this time.
Okay.
Not this time. This time the agenda is going to be your on first
The
and
first, okay,
first encounter. We're gonna work on more or less the same way we work, and I'm gonna really tell you when we meet again. I will tell you how we use a lot of Socratic method, where a lot of a series of inquiries, so that we really create things together, and then so we'll talk about that, and you'll see.
okay.
Any other questions you have for me? Okay. All right. Anything I could have asked you that I did not ask?
No, no,
Okay, perfect. Anything else you'd like to tell me?
Nope.
Great. Well, it's very nice to meet you. Nice to meet you for our first meeting. And look, I will be sending you some time, and then I'll see you next week.
Okay, great.
Okay, take care.
Thank you.
Bye.